Hello, welcome to Dental Notes and Mnemonics. Today we are going to discuss about a very important topic, Bell's palsy. So without any delay, let's get started with the video. Bell's palsy is defined as a sudden unilateral paralysis or weakness of facial muscles due to inflammation or dysfunction of facial nerve, which is cranial nerve 7. It is the most common cause of facial paralysis, accounting for approximately 60 to 70% of the cases. If we talk about the incidence of Bell's palsy, then the annual incidence is approximately to 20 to 30 cases per 1 lakh people each year. Most commonly affected individual ages between the 15 to 45 years of age, and peak incidences around the age of 30 to 40 years. If we talk about the gender predilection, then it is slightly higher in the females, particularly during pregnancy, especially in the third trimester. Individuals with diabetes and hypertension also have a higher risk of developing Bell's palsy. To understand the etiopathogenesis of Bell's palsy, it is essential to grasp the anatomy of facial nerve. The facial nerve has three components. First is the motor nucleus, which controls the facial muscle. Second is sensory nucleus, which handles taste and sensation. And third is a parasympathetic nucleus, which controls glands secretion like salivary or lacrimal gland. We can divide the course of facial nerve into 6 segments. It emerges at the lower border of pons as the two roots, a larger medial motor root and a smaller lateral sensory root, which is also known as nervus intermedius. This segment is known as intracranial segment of facial nerve. After this, it leaves the cranial cavity by passing through internal acoustic meatus, and the part of facial nerve here is known as the meatal segment. After that, it enters the facial canal, which is divided into 3 segments: labyrinthine, tympanic, and mastoid. Labyrinthine segment lies above the vestibule of internal ear and passes laterally to reach the medial wall of middle ear, where it bends to form a genu, and it bends sharply backwards. Then the nerve here runs horizontal backward along the medial wall of middle ear till it reaches the junction of medial and posterior wall of middle ear. This segment of facial nerve is known as tympanic segment. After the tympanic comes the mastoid part. It passes vertically downwards in this part along the posterior wall of middle ear to reach the stylomastoid foramen. From the stylomastoid foramen, facial nerve leaves the skull and passes through the parotid gland, splits into 5 branches of facial expression. So why facial nerve is more prone to paralysis? First of all, because of its long and convoluted course. It is located in the narrow facial canal. Vulnerable areas like labyrinthine segments are highly susceptible to inflammation or compression. Now we will discuss about the etiopathogenesis of Bell's palsy. Bell's palsy results from 3 main factors. First is a viral reactivation, vascular ischemia, and hereditary predisposition. These factors lead to inflammation, compression, and damage to the facial nerve, particularly in its narrow bony canal. When the viral activates, the dormant viruses, especially from the herpes family, play a central role in Bell's palsy. The 2 most common viruses are the herpes simplex virus and the herpes zoster virus. It is more aggressive and causing chickenpox and shingles. These viruses can stay latent in ganglia for years. However, triggers like immunodeficiency or stress cause reactivation, leading to nerve inflammation and compression. Vascular ischemia is the reduced blood flow to the facial nerve is another factor which may be responsible for Bell's palsy. The There are two types of ischemia. First one is the primary and the secondary. The primary ischemia is triggered by the cold, emotional stress, or conditions like diabetes mellitus, which causes a nerve inflammation due to vasospasm. And secondary ischemia results from increased fluid accumulation leading to edema and nerve compression. Hereditary predisposition may also play a role in some individuals. Around 4 to 14% of the cases have inherited a narrow fallopian canal, inherited in a autosomal dominant pattern. This predisposes the facial nerve to compression even with minor inflammation. Let's explore the key features of Bell's palsy in a simplified way. First of all, the symptoms appears all of a sudden and worsen quickly, usually reaching their peak within 2 to 3 days. One side of the face becomes weak or completely paralyzed. This leads to drooping of one side of the face, flattening of nasolabial fold, which is a curve between the nose and mouth, difficulty in blinking or closing the eye on the affected side, trouble moving in lips such as puckering or raising the corner of the mouth. Other eyes and the mouth symptoms includes the dry eyes because of the reduced tear production, dry mouth due to affected salivary glands, and patient often report difficulty in keeping the eye closed completely. Hearing may be affected and the sounds may seem louder or uncomfortable, known as hyperacusis. Pain may occur around the ear on the same side. The ability to taste the food may reduce or change because of the nerve involvement. Regarding the progression and recovery of Bell's palsy, symptoms worsen quickly but may improve with time. The recovery period varies depending on the severity of nerve damage. Now we will discuss about the clinical examination, the diagnosis of Bell's palsy. The first step is detailed clinical assessment. Check for asymmetry in the facial movements such as smiling, raising eyebrows, or closing the eyes. Test the taste sensation on front 2/3 of the tongue. Observe tear production and check for dry eyes. Note whether the forehead is involved. This helps distinguish between the peripheral lesions like Bell's palsy and the central causes such as stroke. If the forehead is involved, likely it is a peripheral lesion as in Bell's palsy, and if the forehead is spared, likely a central lesion, stroke, or the other brain related causes. Electrodiagnostic tests help to evaluate the function of facial nerve and predict the recovery. Electroneurography measures the nerve's electrical signal and it is useful in the first 2 weeks. Electromyography assesses the muscular activity and helps to track the nerve recovery over the time. Nerve conduction studies analyze the speed and the strength of nerve signals. Imaging is used to identify structural issues or other causes of nerve compression. MRI is preferred for detecting inflammation, tumors, or vascular lesions. CT scans are useful for identifying bone-related issues such as fractures of the temporal bone. Functional tests such as Shermer's test or stapedial reflex test are done to assess the tear production and check the stapedius muscle response in the middle ear respectively. These both functions are controlled by the facial nerve. So the key features of Bell's palsy is acute onset, rapid paralysis over 48 to 72 hours, one side of the face is affected, and most of the cases resolve within weeks to months. Diagnosis is primarily clinical, but test can confirm the extent of nerve involvement and guide the prognosis. Bruce-Breckman grading system is a standardized method used to evaluate facial nerve function, especially in case of paralysis. It classifies facial nerve dysfunction into 6 grades based on the symmetry, motion, and overall functionality of the face. This grading system grades the facial nerve into 6 grades starting from the normal function, which is graded as grade 1, to grade 6, which means a total paralysis. This is the most severe form, where there is no movement in the affected side of the face. The paralysis is complete, indicating total loss of the facial nerve function. When diagnosing Bell's palsy, it is essential to consider several key factors to differentiate it from the other causes of facial paralysis. If we talk about the onset and progression, then it is sudden in case of Bell's palsy, with paralysis developing over 48 to 72 hours. This rapid progression is a hallmark of Bell's palsy. In contrast, the other conditions like the tumors or the infection often have a more gradual onset, with symptoms developing over a period of time. In case of Bell's palsy, it affects the entire side of the face, including the forehead. The patient will be unable to raise their eyebrows or wrinkle the forehead on the affected side. On the other hand, in the central causes, as in case of stroke or the other central nervous system conditions, the forehead is typically spared because of the bilateral brain control over forehead muscles. This means the patient may experience paralysis of the lower face, but the upper face may remain intact. Now coming to the treatment part of Bell's palsy, generally the prognosis is good and most of the patients they recover fully. Treatment goal for the Bell's palsy are to reduce the nerve swelling, relieve the symptoms, and hasten the recovery of facial functions. The medications for the Bell's palsy include the corticosteroid. They act by reducing the nerve swelling and improving the facial movement. But the best results are obtained when the corticosteroids are started within 48 hours of symptom of onset. Initial dose is 60 milligrams orally once daily for 5 days, and gradually the dose is tapered and reduced to 10 milligrams per day. Antiviral drugs like acyclovir are used for the herpes related cases. 400 milligrams orally 5 times daily for 10 days is prescribed. It works best in the combination with corticosteroids. For the pain management, analgesics are prescribed to relieve the ear pain and discomfort. For people who have difficulty closing their eyes, eye care is essential to avoid dry eye or injury. Facial therapy may be necessary for improving movement and preventing the long-term problems. Treating Bell's palsy, post-treatment follow-up is crucial for tracking the patient's recovery and addressing any lingering issues. Regular checkups are essential, particularly during the first 3 to 6 months after the treatment. Regular visits ensure that any issues like slow recovery or complications are addressed promptly. The focus is to evaluate the facial nerve dysfunction, eye care, and muscle recovery. The patient's ability to move their face and protect their eyes will be closely observed. Rehabilitation involves the facial exercises, physical therapy, and potentially psychological support if needed. These treatments help the patient regain the facial strength and functionality as well as manage any emotional impact. While most of the patients they fully recover, some may still experience residual symptoms. In such cases, additional treatments or interventions might be necessary. Thank you for watching. This was all about the Bell's palsy and its management. If you found this information useful, please like, share or subscribe for more content like this. Feel free to leave your questions or comment below. I would love to hear from you. See you in the next video. Till then, bye bye, take care and have a nice day.